If you want to see less patients, I don't think the answer is necessarily specializing. Yes, specialists make more money per patient, but have you seen their schedules? Ortho, they see patients. Pedo, looking at their schedules gives me a heart attack. Most oral surgeons that I know have a very, very busy packed schedule as well. And endo, I'm honestly not sure. I think it's less about specializing and more about differentiation. The reason it's so important is because people are willing to pay more for things that they perceive as higher value or higher quality. I'm willing to bet that if you are seeing multiple columns, you are playing the insurance game. Double stacking schedules, assuming people are not going to show up for their appointment, burning out, because seeing volume is one way to outmaneuver these major insurance cuts. But in reality, if you are being paid adequately for the work that you are doing, you do not need to see quite as many patients. So differentiation comes in two forms. You offer a specific knowledge base that other people don't really have, or a specialized skill set that others want. For example, biomimetic dentistry, airway dentistry, or you could be really good at marketing yourself, or it could be a combination of those things. For example, I am a cosmetic dentist and I have a skill set that not every dentist can do. And although I charge a little bit more, I do think my fees are fair. Because basically this is how I would want to be treated if I was getting cosmetic dentistry done for myself. But my practice didn't always start like this. Being paid adequately for the work that I do was key for me to restructure my practice. So again, I don't think it's about whether you are specialized or not. I think part of it is the way that you are playing the game or structuring your practice. I say this because being a strong PPO practice is not a bad thing if you are built to see volume and you like that model and it's profitable for you. It just doesn't work for me. Okay, up until now, I don't think I've said anything that people who are running their practices don't really know already. But the part people don't really talk about is your ambition when you are a practice owner and your desire to do better and better every year. And from the outside, it's sometimes hard to know how well people are doing and how much money they're actually making. The key here is your net profit. So whether you are a specialist or a GP, you build your practice so that you are making more than what your overhead is. For example, I have a small practice in Orange County, which has relatively low overhead for an Orange County practice. So when I crunch my numbers, I am able to do one big case on a Tuesday or a Friday and then leave it at that and go home afterwards. And I make a pretty good living doing just that, and my satisfaction level is really high. But what I do is not commonplace in dentistry. You will find that most dentists will not stop just because they made enough for the day. The goal is often to beat last year and the year before and to keep scaling and growing the business. Like my schedule as a cosmetic dentist, I have other cosmetic dentistry friends that see like 3 of those patients